A nursing mother can be prone to certain infections after childbirth. This is because of the physical and hormonal changes that occur, as well as the demand of caring for the baby. Now, these infections can affect the breast, the genital organs, the reproductive organs, and the general health of the woman. In this video, I will be talking about some of these infections. Now, firstly, let's look at the breast related infections, and also we are going to see whether or not the woman can breastfeed in any of these infections should it occur. So let's dive right into the video. Welcome and welcome back. If this is your first time of seeing my face, my name is Priscilla. I'm a registered and licensed health practitioner. Been practicing for more than a decade here in Lagos, Nigeria, and I'm a mom of three. If this content sounds like what you love, please consider subscribing to the channel. I share content around motherhood, child health, maternal and child health, family health, mental health of women in general. So consider hitting the subscribe button. Join this family today. Let's grow this channel together, and do well to leave me a comment and share this video to as many as you can. The first breast-related infection I want to talk about is mastitis. Mastitis is an infection of the breast tissues, usually caused by Staphylococcus aureus. All right. Now, it occurs in the first few weeks of postpartum. That is the first few weeks after childbirth. What are the signs that you should look out for? You should look out for fever, look out for chills, look out for swelling and redness of the breast. Okay, so these are the signs that you should look out for. But don't forget that if you leave mastitis untreated, can progress to breast abscess. All right, now if you experience any of these symptoms I just talked about, it means you're having mastitis. But the good news is that it does not stop you from breastfeeding your baby. Okay, we are having mastitis infection, you can also breastfeed your baby. Do not say because your breast is swollen and is red, because you're having fever and chills, okay, you will not breastfeed your baby. No, you can breastfeed your baby. It is very, very safe, but you should get treated, else it will develop to breast abscess. Second infection I want to talk about is breast abscess. Remember, I said that if mastitis is left untreated, it can result to breast abscess. And when you have breast abscess, you discover that there is a lump in your breast that is filled with pus. Okay, and you may have to have an incision and drainage before they can get that pus out. But all you have to do is to go see your healthcare provider, and you'll be placed on good antibiotics, and the abscess will be incised and drained, taken off, and you will be fine. Another infection that you can be prone to as a nursing mother is the Candida infection of the nipple. This is caused by Candida albicans, and it is associated with thrush from your baby's mouth. All right. So the symptom you should look at for is itching and redness of the nipple. All right. You look at for pain around your nipple. Your nipple will be inflamed and red. Then there is shining or flaky skin around your nipple. You should look out for these signs. Now, most importantly, you should know that when you develop Candida infection of the nipple, you are not supposed to breastfeed your baby. Okay, so look out for these signs, and when you see any of these signs, seek medical attention immediately. And for the time being, you stop breastfeeding your baby, because this can be passed to your baby. All right. So by the time you have gotten treated and you are fully okay, your healthcare provider will certify you okay to recommence breastfeeding. All right. Another infection that you should look out for as a nursing mom that you can be prone to is genital and urinary tract infection. Okay, urinary tract infection is more likely to occur if a catheter was used during childbirth, or maybe there was perineal trauma during childbirth. Okay, it can occur. Then the symptoms you should look out for are burning sensation while urinating. If after childbirth you go to urinate, you feel this burning sensation, okay, or you always feel the urgency to go and urinate, okay, there is always frequent urination, there's painful urination, you have most likely contracted UTI, that is urinary tract infection. You should seek medical help immediately. All right, so having a urinary tract infection does not stop you from breastfeeding your baby. You can continue breastfeeding while you are getting your treatment. Another infection you can be prone to as a nursing mom is endometritis, that is uterine infection. Endometritis is the infection of the uterine lining, okay, and it can most likely occur after a cesarean section or after a prolonged labor, okay. So the symptoms you should look at for are foul smelling discharge. If you have discharge from the vagina after childbirth and it has an offensive odor, it have a foul smelling odor, or you are always feeling pain around your abdomen. Okay, all right. So you should look out for all these symptoms and get help immediately. But mind you that having endometritis does not stop you from breastfeeding your baby as well. Also, you can have vaginal infection. Okay, vaginal infection can occur after an episiotomy. Maybe if you had a vaginal delivery, you had an episiotomy, or you had tear on your own and you were stitched. Okay, so these whole activities around that place can predispose you to bacterial infections. Okay, and by the time that area is infected by bacteria, you can develop vaginal infections. All right, you can start having smelling discharge. Okay, that area will be red and swollen. Most times you can even have pus coming out from that particular stitch, that area where you were stitched. Okay, if you are still healing and you discover that there is pus coming out from that episiotomy site, the place you were stitched, my sister, you don't have to keep quiet or remain at home. Go and see your healthcare provider immediately, because there is most likely a vaginal infection going on there. All right, but also know that having a vaginal infection does not stop you from breastfeeding your baby. It is very, very safe for you to continue breastfeeding while you are getting yourself treated. Then you can also have a skin or wound infection. Now, this applies to women that give birth through a cesarean section. Okay, now that's your up site, that is your operation site, can get infected. That is where the skin infection comes in. All right, it can get infected by bacteria. There might be wound breakdown. Okay, you can start experiencing offensive odor from that site, from that up site. You can start even seeing pus. Okay, at that point, that wound at that time has been infected, and you need to see your doctor. You need to see your healthcare provider immediately. But also know that all these infections that has to do with the skin, the vagina, endometritis, it is not transmittable via breast milk. That is why I always tell you, for all these other infections, apart from candida infection of the nipple, you can always breastfeed your babies. Okay, continue your breastfeeding while you are getting yourself treated. So when you develop this breakdown of operation site after cesarean section, that is the skin infection, you can continue breastfeeding while you are seeing your healthcare provider and getting yourself treated. Now, talking about the general health of a nursing mom, you can develop a respiratory tract infection. Okay, as a nursing mom. All right. So, respiratory tract infection means that the respiratory tract is being infected either by virus or by bacteria, whichever one. Okay, you can develop flu, you can develop cold. Okay, you can start coughing. But while this is important, is to have the understanding that although it does not stop you from breastfeeding, but care should be taken, because these are in most cases they are viruses. Okay, they are viral infections, and if by the time you sneeze, you start coughing, don't forget that you are nursing. You can as well transmit this infection to the baby. Okay, you can just cough and sneeze and drop those viruses in the air, and your child will breathe it in, and also get infected as well. So as a nursing mom, don't play with cold, don't play with flu. Okay, if you have cough as a nursing mom, don't just see it as it is normal cough, it is normal flu now, it is I'm just sneezing. No, you have to get treated so that it does not linger, because there are viruses and you can easily transmit it to your baby via the air. All right, although it does not affect the breast milk in any way. All right, okay, there's also gastrointestinal infection. Okay, that is your GIT. In this case, there might be diarrhea, there might be stooling. Okay, you might eat something that troubles your stomach as a nursing. All these are infections that you are prone to. As a nursing mother too, your cravings are just over the place. We encourage nursing mothers to eat whatever you want to eat. Just keep eating. Just make sure that at every time you are full, you eat healthy because of your baby. So sometimes all these things we eat may be infected, and it might affect your GIT, and you start stooling. You start having diarrhea, can even start vomiting in some cases. Although this does not affect the breast milk, you can as well keep breastfeeding, but you must not undermine those symptoms. Okay, you should not stay at home and be stooling and stooling as a breastfeeding mom. No, because it is dangerous for you as a mom and also for your baby. Okay, because you need to stay well to breastfeed. If you are dehydrated as a mom, you cannot sit down and have the strength, the energy to breastfeed. So all these infections are very important, that you should not overlook them. They are very, very important aspect of your life as a mom, as a nursing mom. Don't undermine them, don't underrate them. Should you see any of these symptoms, act fast and get medical help ASAP. Now, remember, there are practical steps you can take to prevent some of these infections that we just talked about. Okay, as a nursing mom, you should know that your personal hygiene should be top notch. It should be top notch. Okay, maintain good personal hygiene. Okay, hand washing is very important. You should wash your hand before breastfeeding. You should wash your hand before handling your baby. Okay, also take good care of your breast. Okay, make sure whatever you are wearing, it is clean and it is needs at all time. Okay, personal hygiene is very, very important as a nursing mom. Then again, perineal care. All right, if you gave birth through via vagina and you had an episiotomy or a tear, meaning that you had a stitch down there, don't forget to do your seat baths. Okay, it is very, very important, and you should ask questions and make sure that you are doing it well. Okay, take your routine drugs, take your take home drugs seriously. Don't just get home and dump your drugs somewhere. Remember that being discharged from the hospital, you are under antibiotics cover, you're under vitamin C, you're under hematinics, okay? You're under pain relief as well. All these medications are very important, okay, for you to heal, to get well, and to take good care of your baby. Then, most importantly, make the habit of seeking medical help promptly. All right, like I said, do not undermine any of these symptoms. Should you see anything that is, out of normal, that is out of place, that is strange to you, don't go about asking your neighbors. Don't go about making calls or asking your mother, your grandmother, your big auntie. No, my dear, go seek medical attention ASAP. It is very, very important. Until I see you again in my next one, stay healthy and stay strong.